The townspeople of Dalton turned out to cheer the more than 600 young soldiers returning home, victors in a far-off struggle. The time, November 1918. The future looked promising for these young men. Many would fill jobs at Crown Cotton Mills, the city's largest employer. But just over the horizon, another foreboding foe, a deadly flu pandemic. With no antibiotics and only rudimentary treatments, tens of thousands died. Reminiscent of medieval plagues, bodies were removed in carts. Without a hospital or any formal public health organization, Dalton struggled mightily. Overworked doctors traveled miles of rutted back roads to provide limited care. The more severely ill languished or faced the punishing trip to Chattanooga. Responding to the pandemic's aftermath, Crown Cotton Mills in the fall of 1919 moved to establish a hospital for mill workers that would be open to others. They would rely on the town's hardy band of physicians. Soon, community leaders would seize the opportunity to broaden the project to serve the entire community. Built at a cost of $75,000, Hamilton Memorial Hospital, with its Spanish-style stucco finish and tile roof, faced north on Waugh Street between Pence and Selvage Streets. It was named after the late Crown Cotton Mills president, George W. Hamilton, Sr. The hospital opened to public acclaim on May 12, 1921, National Hospital Day. More than 1,000 toured that day. Signaling one of the hospital's most cherished traditions, community groups and individuals pledged to furnish the facility to a capacity of 42 rooms. Dalton was clearly emerging as the hub of business and industry for Northwest Georgia. An Atlanta Journal-Constitution feature called it a city of fine homes, beautiful churches, parks, and thoroughly credible improvements. But after a decade of relatively boom times, the 1929 stock market crash and the Great Depression hit the country hard. Dalton and its fledgling hospital were no exception. By April 1934, Hamilton Memorial faced a fiscal crisis, and it soon closed amid a sea of red ink. It remained closed for 10 months. Almost immediately, Dalton's newspaper, the Daily Citizen, campaigned strongly for its reopening, and the newly formed Civitan Club and its Civitan Hospital Board diligently tackled the challenge. Through a lease arrangement with the hospital's board and the financial support from both its own members, the city, the county, and generous citizens, the Civitan Hospital Board agreed in 1935 to reopen the hospital. Hamilton would operate as a civic enterprise for benefit of the people of Dalton and Whitfield County. With the onslaught of the Second World War, many physicians left to serve their country, and Dalton and the hospital struggled with few doctors. At war's end, returning servicemen, along with a thriving economy and population, quickly began to strain Hamilton Memorial's limited facilities. Crowded conditions would soon plague patients and staff. On July 1, 1951, the Dalton City Council adopted a resolution creating a hospital authority, clearing the way for the hospital to receive Hill-Burton funds to offset some of the costs of constructing a new hospital. An even dozen of Dalton's leading physicians dug deep into their pockets to enable the hospital authority to acquire the site for the new hospital. With local funds of some $450,000 and a Hill-Burton grant amounting to $900,000, construction of the new 73-bed Hamilton Memorial Hospital was dedicated August 5, 1956. With its first full-time administrator, Norman D. Burkett, on board, much planning and preparation was underway with strengthened professional standards, national hospital accreditation, an ambitious Gray Ladies program, and more. One other important step: the hospital would eliminate all vestiges of separate care and service based on race. The hospital would continue to grow and expand over the next 2 decades to meet the needs of a city and region rapidly expanding in tandem with the area's textile and carpet industries. But with the downturn of federal dollars to support hospital expansion, Hamilton's leaders foresaw a need for bolstered private support. Noted hospital trustee Jackson P. Turner led the way in the 1975 creation of the Whitfield Healthcare Foundation, an independent affiliate seeking private gifts for Hamilton. The foundation would further stimulate contributions that a generous community had made time and again. Throughout the 1970s, Hamilton Medical Center continued to grow, adding technologies and facilities to keep pace with medical advances and the needs of a thriving city and region.
In 1982, the hospital was renamed Hamilton Medical Center to reflect its expanded role as a regional healthcare provider. Hamilton Healthcare System was also established to serve as a parent company to the rapidly expanding services being introduced to serve the region. An interest in personal fitness brought a nationwide shift in the philosophy of healthcare. Called wellness, it focused on the growing link between harmful habits and disease. Hamilton was ahead of its time in partnering with community members to make better lifestyle choices through education and exercise. In October 1986, Hamilton realized another major milestone with the opening of the Bradley Wellness Center, a 54,000 square foot comprehensive fitness, health education, and rehabilitation facility, half a block from the medical center. Another important plateau was reached in 1992 with the opening of Royal Oaks, the region's first continuing care retirement community. It offers independent living, private apartment homes with a range of social and lifestyle amenities and assisted living suites, known as the Gardens, with around-the-clock personal care. Throughout the 1990s, Hamilton expanded its mission to seniors through the development of Whitfield Place and Whitfield Commons, offering housing to low-income seniors. Also, to assure careful coordination of skilled nursing care, Hamilton acquired the region's skilled nursing facilities, including the development of Regency Park in 1999 at the Royal Oaks campus. As the 21st century dawned, Hamilton had expanded not only its scope of services, but its reach in the region through placement of a physician specialty clinic in Calhoun and through the lease of Murray Medical Center in Chatsworth. Rapid expansion and renewal continues as Hamilton plans for future medical advancements unimaginable in the century before. Enhancements have included the expansion and replacement of surgical care, maternal and infant care, and emergency care services. Hamilton has also instituted a nationally recognized freestanding ambulatory surgery center and a research-focused regional cancer institute. Significant advancements have also been achieved through development of cardiac, vascular, and neurosurgery programs, and through the acquisition of world-class technologies like advanced computerized tomography, high-definition MRI, and digital mammography. In the beginning, Hamilton was an idea born of necessity. A growing community critically needed a hospital to care for the injured and ill. As the community and its surrounding region grew, so did the health system. Today, Hamilton touches the lives of area residents in ways never dreamed possible when the hospital was established on Wall Street. The sophistication, reach, and range of services keep expanding, while the nearly century-old pledge to treat all in need of care remains deeply ingrained in Hamilton's mission. It's a mission that continues to inspire active support and involvement from civic-minded community leaders joining Hamilton's noble heritage. The ideals which have driven Hamilton's success in the past, an unceasing search for excellence and compassion in healthcare, fueled by the generosity of the region it serves, will assure greatness tomorrow.